Anything happening with the toe can be related to the spine.
Back pain with leg pain needs to be looked very critically at. While walking at home, my bathroom slipper falls off.
I should be very concerned about this.
Yes, sir, you need to be concerned.
I made a mistake by, lifting a heavy box. The moment I did that, I experienced a excruciating pain in my back. If you could tell me, how do I arrive at a conclusion that what has happened to my spine?
So normally when we have back pain, we can have back pain by itself or we can have back pain with leg pain. Back pain by itself is not as dangerous of short duration, but back pain with leg pain needs to be looked very critically at. Normally when we lift weights and we bend forward and we have unaccustomed postures while doing so, we may have a slip disc or a bone may get angulated in a certain direction. If we have certain unstable situations in our spine pre-existing, they may get aggravated or accentuated, and these may need to be investigated. So normally we examine thoroughly the patient. We look for red flags, which is weakness of toes, loss of sensation, loss of control of urine and motions. And after having done that, we do a few tests. Normal tests that we ask for the lower back are x-rays of the lumbosacral spine. We may ask for x-rays of the hip. If there's a neck issue, we may ask for neck x-rays. We then would do some blood work and bone density in the elderly. If there is no weakness or if there is no significant radiating leg pain. However, if there is any of the above, or if we've treated the patient for about 2 to 3 weeks and the patient is not feeling better or the leg pain starts coming in, then we ask for an MRI. X-ray shows only the bones. MRI shows soft tissue as well. So it can show the disc, it can show the nerves, it can show the joint tissue, it can show abnormal collections of fluid, if any. If we need investigation beyond this, okay, really is that nerve getting affected? Then like you have an ECG in the heart, which shows the graph.
Yeah.
We have an EMG nerve conduction for the muscles and the nerves of the lower limbs or the upper limbs. So we can study, is the left foot weaker than the right? And if the left foot is weaker, is it just the toe? And if so, which toe? So which nerve is getting pinched? So it helps us navigate and find the culprit. So these are tests that we normally do. Having said all this, it will vary from patient to patient depending on your clinical finding. So what you may have may be different from what your wife may have, may be different from what your son, who's 25, 30 may have. But each patient, we have to have a very low threshold for investigating if red flags, as mentioned, are present.
You mentioned something about the toes.
Yeah.
If you can kindly elaborate.
In a slip disc, commonest disc which gets slipped is L4, L5 or L5, S1. You must have heard of this. Most people talk of that.
Yeah.
This affects the ankle and toe movements.
Okay.
And at times, if the great toe or the second, third, fourth toes get weak, patients even come and tell us that while walking at home, my bathroom slipper falls off from one leg.
Yeah, this is a very common occurrence in my case.
Exactly.
Yeah.
Which means that your L5 nerve may be getting weakened by an L4-5 disc. This is an assumption. What's a diagnosis? It's an assumption. After you get the evidence of an X-ray, MRI, EMG, the diagnosis is confirmed.
True.
So clinically we assume, so we get a clinical diagnosis based on your history and my examination. And finally, evidence then tells us the way forward.
I think after hearing you out about this, I am more bothered because I never understood that, anything happening with the toe can be related to the spine.
Absolutely. It does happen. Sir, if there is no water coming out of my tap, it's not necessary that the problem is in the tap. It could be in the tank up there. That's exactly what happens. The problem is in the lower back, but the final effect is at the toe. That's how it works.
So I should be very concerned about this?
Yes, sir, you need to be concerned.
And the way forward is, as you suggested, the investigations.
We see the doctor first, we then investigate, and then we come to a final diagnosis.
I think I'll move out of your chamber very heavy-hearted and come back with the test. Let me get them done and follow your instructions.
Pleasure.
Thanks, Adan.
Thank you so much.